flus and severe colds this year. Many people are wearing masks and social distancing, and it is making a real difference. But we are still far from the end of this pandemic, especially with the vaccine in short supply, millions that still need to be vaccinated, and new variants in the mix. That means we have to keep doing the things we know work. I've said it, I'll say it again. Practicing social distancing, washing our hands, and wearing our masks. Today's action is a show of confidence and trust, but we must remain cautious. People are losing their loved ones each day. We must keep up our guard. Many of us are weary, but we cannot let the weariness win. Now is the time to put our strength and resilience to work so that we can continue to turn the corner and get through this pandemic. Also with me today is our Secretary of Public Safety, Eric Hooks, and our Director of Emergency Management, Mike Sprayberry. Monica McGee and Lee Williamson are our sign language interpreters, and behind the scenes, Jasmine and Jackie Mativier are our Spanish language interpreters. We'll now take questions from the media. If you can give us your name and who you represent, we'll take the first question.
Our first question is from Katie Peralta with Axios Charlotte.
Hey, Governor Cooper. This is Katie Peralta Sola from Axios Charlotte. I had two questions. First of all, would you consider where we are today as some kind of turning point in the pandemic? I mean, it seems that this is the most sweeping lifting of restrictions that we've seen thus far. My second question is, are you worried about a backslide? You know, people seeing this as an excuse to go back to normal and kind of revert back to how things were pre-pandemic?
First, we have followed the science and the data from day one, and we have seen continued improvement over the last month. All of the numbers continue to move downward and stabilize. And when you look at the restrictions that we have put in place, the mandatory mask mandate, the curfew, you know that we are serious about slowing the spread of this virus. And I think that people have pulled together. Many are wearing masks and social distancing. Most businesses are complying with the executive orders. I think there's been a positive effect, and people deserve a pat on the back. And what we said all along, that if our data indicates that we will ease these restrictions. Notice that we're only lifting one restriction, and that's the modified stay-at-home order and the curfew. And we still have these other capacity restrictions in place and safety protocol requirements because we know that this virus is still here. Of course, you're concerned about the potential to backslide, and this is why we're going to continue to emphasize the importance of wearing a mask and social distancing, but also why we are continuing these restrictions in place, because we know that when people gather together, that there's a greater chance that the virus can be transmitted. So we think this is a positive step. We are going to continue to watch the data. If we can move some more in the future, we hope that that will happen as more people get vaccinated and we continue following the rules. But we're going to put health and safety of people first, and we'll do what we need to do in order to make sure that that happens. Next question, please.
Our next question is from Jonah Kaplan with ABC 11.
Governor, Dr. Cohen, good afternoon. This is Jonah Kaplan from ABC 11. Governor, I appreciate the opportunity to ask this question. We know businesses have been hit hard by restrictions and economic setbacks over the last year. Does this do enough to get North Carolinians back to work and help jumpstart the economy again?
Well, many businesses have just been hit hard by this pandemic, period. A lot of people are taking themselves out of commerce and retail and restaurants and bars and hotels because they are concerned about their own safety. And we know that certain industries have found opportunity in crisis and that we've had some strong growth in jobs in many areas. But particularly the hospitality industry, the restaurants, bars, hotels, the travel industry, the airlines, they have been hit really hard. And state and federal government need to continue to step up and to provide help to them directly, because that's an important part of North Carolina's economy. We're a great place to visit, and we want that to thrive. But we still are in the middle of a pandemic. We still have a virus that is very contagious. So we have to do things to protect the health and safety of people. I do think that easing restrictions, as long as people come back carefully, can help these businesses. We know that many of them are struggling and that this won't bring them fully back. But we want to put health and safety first, and we think that this move does that. Next question, please.
We have a follow-up, Jonah Kaplan, ABC 11.
Governor Dr. Cohen, on this beautiful day, gets many people thinking about summer and about summer concerts and summer festivals. If PNC Arena can open, what about Walnut Creek Amphitheater? What about Red Hat Amphitheater? And what will it take for outdoor venues to start welcoming people for concerts?
So with this order, Walnut Creek and Red Hat Amphitheater outdoors would be able to open at 30% capacity beginning Friday. They would have to take additional safety protocols, worrying about social distancing, people gathering into corridors. I think health officials feel much better about things that are outside than they do inside, and that is reflected in this order. But I'll let Dr. Cohen address that issue as well.
Thanks, Jonah. I think the governor hit on it. So those outdoor venues are going to be open starting Friday. Again, outdoor settings allow for better ability to both spread out, but we want to make sure that folks are wearing a mask. As the governor mentioned earlier, the mask mandate is not changing. So wearing a mask, staying socially distant, washing your hands, still going to be an important component. But it's great to see that we can take this step, particularly outdoor venues can be open at 30% with those safety protocols. Thanks.
Next question, please.
Our next question is from Cullen Browder with WRAL.
Good afternoon, Governor. Cullen Browder with WRAL. I know you referenced the improving metrics when you make these decisions. How much do you base your decision on listening to people, whether it be parents or business owners or lawmakers, some of whom filed bills this week to increase capacity at sporting venues?
We listen to all of those people. We have listened to lawmakers and have talked to them. I've talked to families. I've talked to business owners. So many people have been hit hard by this pandemic. But the controlling issues are the science and the data, and I think you can see that in decisions that we have made from day one. The more the scientists and health officials learn about this virus, we try to make sure that any kind of restrictions or closings reflect what is being learned. So I will tell you that it's the science and the data and those improving numbers that you just saw Dr. Cohen list have led us to this decision. If we were still where we were in December, you wouldn't see that from us, regardless of what other pressure would be put on by any people or any legislators or anybody else. We are sticking to the science and the health data and have done that from day one and are going to continue to do it. Next question, please.
We have a follow-up, Cullen Browder, WRAL.
Governor, what message should this send to companies that have a lot of employees working remotely right now? Should they bring some of them back under this order?
I'll let Dr. Cohen address that specifically, but I think we still want to encourage remote working as much as is possible out there. This is the dimmer switch approach. And if you can get your work done and can get it done remotely, then that's a better situation than having a lot of people in an office setting. But I'll let Dr. Cohen address that specifically.
Thanks, Cullen. As the governor said, yes, we would continue to encourage folks that can be working remotely to continue to do that. Remember, as we said, our trends are improving, but we saw that still more than 50% of our counties are either red or orange in terms of level of viral spread and impact on our hospital system. So we're certainly heading in the right direction, and that is reflected in the easing of these restrictions. But remember, as we ease them, we still are keeping capacity limits because we know this virus is so contagious, and we know that those variants of COVID-19 are here in our state, and those variants meet an even more contagious virus. So we certainly need to keep our guard up. I'd encourage all employers that can continue to keep their employees remote to do so as we continue to hopefully watch our trends, and we'll see how we evolve over the next number of weeks and months. Thanks.
Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. I wanted to follow up on one of your answers about workers. Are you still asking state agency employees to work remote, or are they expected to go back at a certain time? And then also you talked some about the decision making. How much have proposals from sports and bar association factored into the timing of this restriction easing?
Well, to answer the second question first, we're sticking with the science and the data, and that is what has told us to do these restrictions to ease these restrictions the way we have. As for state employees, there are some departments we're headed by people who are independently elected, but we are still encouraging remote working whenever possible. Each agency head is dealing with that. There's some workers who obviously need to have to come into work, and those who are working on the front line, but we're encouraging as much as possible for us to protect our state employees as much as we can, and remote working is still encouraged. Next question.
We have a follow-up, Dawn Vaughn, News and Observer.
Hi, thanks for the follow-up. And also what you said earlier about Senate Bill 37 and having most of the schools open, that's still, about 20 districts that won't be open. If you didn't like the bill that's on your desk, why not just mandate that school districts open with the protocols that you want for Plan B?
So I still think that local control is most important here, but we are strongly encouraging all school systems to begin in-person instruction if they have not. And a lot of school districts have responded to this. We're hoping that more continue to do so. But if the legislature wants to pass a bill mandating it in all counties, then I will sign it as long as they fix those two issues, making sure that all the schools abide by the Department of Health and Human Services health guidelines, and I would think that people would want to do that. And secondly, preserving the emergency authority of state and local officials in the event that there is a problem where we need action. And I'll be glad to sign the bill if they'll send me one like that. Next question, please.
Our next question is from Michael Hyland with CBS 17.
Hi, this is Michael Hyland from CBS 17. During a meeting with state legislators on Tuesday, so just yesterday, Dr. Cohen, you reiterated some of the same concerns that you've had all along about the potential for the virus to spread in bars specifically. Why do you think now is the time to open bars for indoor service?
Hi, Michael. As we went through earlier in the presentation, all of our trends continue to move in the right direction. Our cases are down, our percent positive's been down, our hospitalizations are down. And remember, as we ease these restrictions, it is just that, an easing of restrictions. So indoor capacity needs to be limited to 30%. Alcohol sales need to end at 11 p.m. Folks need to be wearing their masks anytime they're not actively eating or drinking. So we think with those protocols in place that it is the right time to take this step forward. It is just a step. And again, we'll watch our trends. And if that's something that we see more viral spread in those areas, we'll reassess as we go. I hope that is not the case. I hope folks will really take to heart that we need to keep doing the 3 Ws as we move forward here. Remember, there are more contagious variants of this virus here in North Carolina right now. But I do think that this is the right step at this moment to be able to ease these restrictions. And again, this is because of a lot of hard work of North Carolinians for really a year in trying to protect each other, slow the spread of this virus. And the other change here is we know we have 2 vaccines that we've been getting into arms incredibly quickly. We've administered more than 2 million doses. Again, that's more than 1 million people have gotten at least a first dose of a vaccine here. So that's really good news for us in North Carolina. So we're certainly heading in the right direction. We cannot let our guard down as we do it, but I think these are the right steps forward. Thanks.
Next question, please.
Follow-up, Michael Hyland, CBS 17.
Thank you. Based on what you know now with regard to the COVID-19 variants, how confident are you that you won't end up reversing these decisions today in the next several weeks?
We'll continue to let the science and the data guide our decisions. And if we see that kind of a variant that is causing significant problems, then we'll discuss it with health officials and scientists, and we'll do what we need to do. Would you want to add to that, Dr. Cohen? Thanks. Next question.
Our next question is from Brian Anderson with the Associated Press.
Hi, Governor. Brian Anderson here with the Associated Press. I have one question for you and one question for Dr. Cohen. For you, in exactly 2 weeks, you would be eligible for a vaccine under the provision that elected officials can get the rollout. Are you planning to get vaccinated then? And for Dr. Cohen, I'm just curious if there are any plans underway right now that would vaccinate teachers on their school grounds. Thank you.
I'm going to get vaccinated when my group comes up. I'm not sure exactly when that will happen, but I look forward to getting my vaccination just as other people are out there. Dr. Cohen.
Hi, Brian. So yes, starting today, our teacher and other school personnel, our bus drivers, our cafeteria workers, as well as our childcare